presentation here.
Nope.
No, can't do that one.
And I'll also, oh, did she? I think she might have
Did we lose her?
left. I was just gonna say, I'll watch the chat for anything, for questions.
Okay.
I actually don't see a chat button on my screen for some reason, but I'm assuming it'll pop up if anybody has a chat. Oh, there she is.
Last time we did this, I was on the call, but nothing worked. So I couldn't talk, I couldn't be on camera. It was terrible.
Oh no.
So I'm praying that this doesn't happen again because
Yeah, that wouldn't be as good.
I apologize. Teams doesn't like me opening things in here so that it booted me out. So give me just a second while I get this
Yeah,
together.
that's fine. I was just telling Mike, I'll watch and keep a lookout for any chats that come in so you don't have to be paying attention as closely to that.
I would greatly appreciate it. Sometimes it's
Yeah.
hard to look at both things.
Yeah, of course.
So as soon as I can get this, Michael, thought I had it all set up. All right, almost there.
All right, sounds good. And I'll also just mute myself too, so there's not too much going on.
And let me see, my camera's off for some reason. Now there we go. And so let me share my screen. Okay, can everyone see that?
Yes, we can.
Okay, perfect. So now that we're ready, is everyone on as well?
Yes. Yep, we're good.
Okay.
We should have a full audience.
All right, perfect. Good morning, everyone. My name's Maria Garcia. I am one of the facilitator enrollers with Excellus Blue Cross Blue Shield. And I work aside with Michael Maniolfi, who's going to be here with us. And we're going to just talk about our primary care dental and vision providers. We're going to give you information about the different benefits that we have. And so this is really informal. You feel free to ask questions, raise your hands. We'll be more than glad to answer those for you. And so we're going to start with our dental plan basics. So our dental plans do cover free preventative dental care. So your regular routine doctor exams, your screenings, your wellness visits, your cleanings every 6 months, which is very important. For those of you, depending on the plan that you have dental, there should be a dental phone number on the back of your card. Customer service, they can help you set up your dental benefits as well as help you find a dentist. We also do telemedicine through our partners MD Live for things like insect bites, sinus infections, if you have pink eye. I've used it. It works wonderful. They could also call in a prescription for you. So take advantage of that. It's right at home. You don't have to go out anywhere. So it's right conveniently there for you. Okay, now, if you ever find yourself in an emergency situation anywhere in the world, emergency visits are covered by in or out of network provider. And so we're backed by most trusted carriers for more than 80 plus years here in Excellus, right here in upstate New York. These are the benefits under your dental coverage. So your 2-year cleanings every 6 months, your oral exams every 6 months, 2 x-rays per year, And so they will do the x-rays, the full mouth, the bite wing, which is 6 to 12 months, and anything else that's medically necessary. Oops. Simple extractions and fillings, and then crowns. So anything that's medically necessary will be covered. So please make sure you call and make that appointment. And if you ever have questions about your coverage, our customer service representatives are the experts. And so I know that we get comfortable with one person. So I do get a lot of my consumers that'll call me to ask me questions. Is this covered? Is that covered? Well, I reach out to customer service first too, because they're my experts. They're the ones that tell me what can and cannot be covered. So make sure you always use that customer service number if you have any questions about your benefits or any billing. Orthodontia for kids up to age 19, it is covered. It is a covered benefit if it's medically necessary. But again, to make sure of what benefits you have, contact the dental customer service on the back of the card, and they can tell you what's covered and not covered.
Could you explain
Denture?
what the vanity coverage was?
Okay, so no vanity coverage, fancy word. That basically means no, nothing that's cosmetic. So if you want to fix your teeth because you have, a little something wrong with it, it will not be covered. They will only cover medically necessary. So that's what vanity means. It's basically cosmetic. It's just like the eyewear and the vision too, glasses versus lenses.
Can you please expand on that? Because a lot of our students don't know necessarily the difference between cosmetic and medically necessary.
Okay, so
So like
medically,
examples.
so the medically necessary, it's for example, you have infections all the time. It's really you have a lot of abscesses because of infections. So this is really making you sick because of it. And if they don't fix it, then it could harm you. So that's what I mean by medically necessary. If you just want to have a pretty smile, or you don't want to wear the big ugly glasses, those are things that are considered cosmetic. So like cosmetic surgery, if you wanted to get your nose done, anything cosmetic will not be covered. So
So
only if
braces
it's
aren't
medical.
covered.
Braces are not covered for adults unless they are medically necessary. So if you go to the dentist and he says, if you don't get these fixed right, something's going to happen, the dentist will tell you if it's medically necessary, and they can request that from the insurance company. So your doctors will always tell you your insurance will cover it because this is medically necessary, and they will send a referral if they need to. Okay. So don't think you can't get it done. If it's emergency, urgent, they will cover it. But again, not to, just want to be pretty on the magazine with little pictures. I would love to have a lot of things done, but unfortunately I would have to pay out of pocket for that. Did that explain it well, or did you need me to go into deeper information here?
I think that's fine. Thank you.
Okay, you're welcome. All right, so we did those. Orthodontist done. Dentures will be covered, but they don't cover the implants, and so only removable, complete, and partial dentures. And here's the vision where we were just talking about a few minutes ago. So you do get your annual vision once per calendar year, standard lenses and frames included once per year. So that's your lenses and your frames. And usually when you make your appointment and you go in to get your glasses, they will show you the glasses that you're eligible for. And here's a pretty hefty or a neat tool that you can use online for those of you that are technically challenged, or and you're able to go on the internet. You want to look for a doctor. You can just go into our Excellus Blue Cross Blue Shield website, There is a tab that says find a doctor or a dentist or a pharmacy. Anything that you may be looking for should be right in this area, even including finding a plan. If you decide you're no longer eligible for the plan or you want to find a plan, this is also a great tool. And it'll get you to one of us if you need assistance, of course. And you can also download our mobile app. And so you can choose the type of provider you're looking for. You can search within the local, national, or global network. You can select the plan that you have. And so that to narrow your search by zip county or a specialty or even a doctor's name. And so for those of you who have an iPhone or Android smartphone, you can download our app, and it's pretty user friendly. What about our network? So I did a lot of educational classes many years ago when we used to be over at the Department of Social Services with some of our plans. And so people used to ask me, why would you go why would we go with your plan instead of someone else's plan? Well, I always brought up our network because we do have 99% of all the doctors and 100% of all the hospitals. And so you can also have that similar level of comfort with your dental and vision needs. And so we emphasize that because we have doctors all over New York State. And so that if you needed a specialist, I'm pretty sure that you will not have an issue finding one.
So just to clarify, that
Mhm.
99% of all doctors and 100% of hospitals means that 99% of doctors will take Excellus insurance.
That is correct.
Okay.
So we do have 99% of the doctors in New York State. So yes.
Okay.
Okay. And now to utilize, you can utilize the doctor lookup tool to see if your doctor participates with our network. You can do you can also always ask your doctor if they do take the insurance, because we have a lot of family members or friends. There may be a doctor that they want to go see, and you want to be a part of it. You can always call them and see if they're taking patients, and they will assist you with that information. And you want to make sure they take, or at least ask, do they take Excellus Blue Cross Blue Shield? Are there any questions about the providers? Or is anyone, or has anyone ever had an issue finding a doctor in the area?
Hi, I have a
Hello,
question.
sure.
So people have a blue choice option,
Uh-huh.
okay? It's part of Medicaid and blue choice option. Can they go to see the dentist? Is there certain criteria that they have to go by? Because I have a client of mine would like to have a root canal done, and will Excellus blue choice option accept that?
So your dental under Excellus or Blue Choice option is through HealthPlex. And so, and did you say it was a crown that needed to be done?
I think it's
It is,
more like a root canal.
it's a root canal. It
Yes.
sounds like it's medically necessary. And like I said, if it's medically necessary, they will cover it. So they
Okay.
will cover the root canal or extraction.
Okay.
Okay.
So the doctor have to apply for it, because I know Medicaid refused it already, but he does start with blue choice option effective October 1st. So he
Yes.
should consult with the doctor.
Yes, so there is a dental customer service number on the back of his card,
Yep, yep.
and just have him call that number and they can assist him with setting up his dental benefits.
Okay, thank
Okay,
you.
you're welcome.
And just,
Anyone else?
can I just
Yeah,
chime in
go
real quick?
ahead.
Piggyback off you, Maria, real quick. Just to chime into everything too, when it comes to dental, vision, medical, it's a case by case per person. Everybody's not going to be the same situation. So just keep that in mind as well when it's when you go for certain procedures.
Okay, thank you.
You're welcome. Anyone else? And these are all great questions. There is no wrong question. So if you have any questions, or if you have a example or a scenario that, you know, you've had some issues and you weren't able to get the care that you need, we emphasize on the care that we provide for our consumers, and we want you to be satisfied and also get the level of care that you need.
Another question.
Sure.
Do you have insurance just for dentists, dental care?
And so we
Basic
have
insurance.
Yep, we do have a standalone, it's called a standalone dental insurance. So we do have two. There's uh Excellus Premier, and there's an Excellus Basic. And so you can also apply online, or you can come through one of us and we can help you apply. They are, one of them, I believe it's $35 a month. And the other one, I believe it's $54 a month.
Okay, okay,
but
that's good
You
to know.
could purchase that. You're welcome.
Thank you.
You're welcome. Anyone else?
What's the eligibility for this insurance, or
For the
what's
dental plan?
for Excellus in general, just what you were talking about with how vision's included and dental, is that a certain plan that people have to sign up for to get that
Yep.
bundle?
So Blue Choice Option is one of our Medicaid managed care programs. And so if you are eligible for Medicaid, you're eligible for Blue Choice Option. And now the next step up from there, so when you become ineligible for Medicaid, then as long as, for example, if you're a single person making under $25,000 a year, you're eligible for the Essential Plan. The Essential Plan covers dental and vision. Now, last year or before COVID started, there used to be a fee, a price that you would pay. So it would be $20 a month for medical only, or $47.82 a month for medical, dental, vision. Now, because of COVID, they have removed those premiums. So it is a free plan for those of us that are eligible for it. So if you're no longer eligible for Medicaid, this is one step that you can go above. Now, if they're kids, kids can enroll into the Child Health Plus up to the age of 19. And it doesn't matter how much the parents make. There is a premium. It could be free. The next step up is $9, then it goes up to $15. It goes up to full premium, which is like $240 a month. And so you could apply for one of those. But if you're above the income guidelines, then it changes things, because now you would have to purchase dental extra, and you would not be eligible for vision benefits. So for those of people that are not eligible for the vision benefits, I usually tell them they can go to like an American Best. There are places out there you can purchase a pair of glasses with the exam for $69.99, which is usually what I do because it's more affordable for me. But only Essential Plan and Medicaid Blue Choice Option will cover medical, dental, and vision.
Okay.
Okay.
Hmm.
Anything else? No? Okay. Well, next I have all of our contact information, and so you can reach me at any time. My direct number with Excellus is on there, as well as my email address. So is Michael's. If you have any questions, feel free to reach out to him. And we also included member services so that you have that available as well. If you don't have your card, this is the number you can call, and they can assist you with any of the plans that you call about. And then we also have our website so that you can utilize it.
Would you guys recommend contacting member services or one of you guys if people are interested in signing up or seeing if they're eligible for these plans through
So-
Excellus?
Sure. No, we would prefer you would contact either myself or Mike, so that we can get you an appointment with either myself or one of our other facilitator enrollers. So we're all across the throughway and we would help you with that enrollment. So if
Okay.
you need to sign up or see if you're eligible, contact one of us. If you already have the plan and have questions about your benefits, then you can call member services.
Okay, okay. And even if somebody's on Medicaid, they can call and ask about this?
So Medicaid is, if it's straight Medicaid, which I don't think there's a lot of people on straight Medicaid anymore unless they have a third-party insurance. But we would only talk about Blue Choice option benefits. Medicaid has a customer service number on the back of the card as well, and that's where you would call for the Medicaid services.
Okay,
Do you, another question,
Mhm.
what if people on straight Medicaid, do they need a referral to join the Blue Choice option, or do they are referred by DHS?
Nope, you can enroll on Blue Choice option anytime. There is a customer service number that you call, and I think we will add that on, but it's done through the county. So whenever you want to enroll into a Blue Choice option plan, you can call the county. And what are they? I'm trying to think of. I used to know the phone number by heart, but I don't know it. But I'll make sure that Mike gets it to the proper people so that they can share that with you. But you can
Okay.
call on the phone and enroll. As long as you're eligible, they will enroll you.
And the income guideline, is it on your website?
The income guidelines for some of our plans are on the website and also under New York State of Health.
Thank you.
You're welcome. Okay.
how was that for classrooms? Do you guys have questions? I know Maria might need to leave soon, but Mike's gonna stay on if you guys have
Mhm.
questions. So feel free to take a minute and think about that.
And while you do that, let me just look and see if I could find that phone number. And Mike, I'll make sure that I send it to you so you can add it to the presentation.
Sounds good.
What was it? Mm, 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 mm.
I know what number you're looking for, and I'm trying to find it too.
And I knew it by heart, and it's been so long. Oh, here we go. Maybe this is it.
And like I mentioned to Hannah too, and this is just for the classrooms, if any student or anyone has questions or is curious about their health insurance, want to change plans, what we can do is one of two things. Is we do have referral cards that we can drop off and somebody can fill it out and send it back to us, or we can leave you like a permission to contact form where you can fill it out and have the school send it back to myself, Maria, and one of the other facilitator enrollers can reach out to set up an appointment to answer any questions that anyone may have.
Okay, I'm gonna send this to you too, Mike, but here's the phone number for those of you who
Okay.
have straight Medicaid and who want to enroll in the Medicaid managed care plan like Blue Choice option. And
Mhm.
so there's the 1-800-505-5678.
505.
Yep, 505-5678.
Okay, thank you.
Yep, and they're open from 8:30 a.m. to 8 p.m. Monday through Friday and 10 to 6 on Saturdays.
Okay. And now if people are in Fidelity in another insurance and they want to join the Blue Choice option,
So,
what is the procedure?
so if you have like Fidelis or MVP or United,
Yes.
that, yeah. So the way it works, if once you enroll into, for example, Fidelis, you have 90 days from the time that you enrolled to change that plan to any other plan. If you go above the 90 days, you have to wait. You get into a lock-in period where you can't switch plans. You would have to wait until renewal time to do that. And so when you're choosing a plan, you have to be aware of those things because you want to make sure that your doctor accepts the plan that you're going with and make sure that what you need is with that plan before the 90 days. After the 90 days, there's nothing they can do.
So you have to lock up. That means you have to be there for a whole year.
Correct.
And then you can change it. When is the time to change it again?
So usually you have to do a renewal every year.
Yes.
And so you will receive a letter 60 days prior to you having to renew. And that's when you want to enroll or change.
Okay, thank you.
You're welcome. Okay, anyone else? Okay, well, I thank you so much for all the questions and welcoming us into your classroom. And like always, feel free to contact me or Michael. We'll be more than glad to assist you in the process. And if you will have access to this PowerPoint as well, we will add that number to it. This is all fairly new, so as we go along and we find things we need to add to the presentation, we will.
Thanks, Maria. That was really, really great. We appreciate it.
You're welcome.
you.
You all have a great day.
Yeah, have a great day too.
Thanks,
Thanks.
Maria.
You're welcome. Bye-bye.
How are the classrooms feeling? Are you guys, just everybody, I don't want to leave anybody, with questions or the stuff you want to say or ask.
Hannah, really quick, do you want me to hang tight on here just in case anyone else?
Yeah, just maybe give everybody a minute, and if you're all right, just give me a thumbs up. Class.
And just remember, this process is sometimes confusing. So having somebody to advocate for you, like a health plan, like an Excellus or a Fidelis or United, people like that, any questions you have, that's what we're here for, is to help you. And just remember too, through this process, everything is non-biased, meaning if you meet with Excellus, you do not have to enroll into an Excellus plan. You can enroll into any plan. So there's just different perks to different plans, one of them being the network where we're, almost everywhere. So, you may run into issues with other plans, with other doctors. So that's usually a big deciding factor with folks. So just, like I said, don't be afraid to ask any questions, no matter what it is, because that's what we're here to do. We're here to help.
That's great. So that's really good to take away, guys. You can talk to them and there's no pressure. You don't have to sign up with Excellus. That's not required. You can talk and just get information. So that is really good to know. But it looks like, I think everybody's pretty much set. I saw Gina and Rebecca give me a thumbs up and Quinn. So,
Anna, I have one more question.
okay, go ahead.
Mike.
No, go for it.
Mike,
Yes.
a lot of our clients can speak English.
Okay.
Okay. So when they call and I try to advocate for them, and the customer service line will just say that, well, it's a HIPAA rule. We can't talk to you regarding their matter.
That That is correct. So, which I was going to mention earlier when Maria was going over it about the member services, we do have a translation line that's available as well. So when you call, they'll ask you what language you speak. You know, Spanish, different languages like that, and you just and then usually they will connect you with a translator that will then be able to answer the questions
The
from
problem,
the other side.
the problem with our students, some of our students, they just came to this country about a month or 2 months ago. They don't have no clue what question they should ask. Like, I give you an example. I have this guy who is lost. Why is he not getting medication? Why is he cannot get the dental care? And I put him through the interpreting service light. But
Okay.
he said, what am I supposed to ask her? So what I did is I had to go on freeway light conference. I said, the guy have no idea what he's supposed to ask because I work on this every day. So I know what question to ask. So that's the problem we run into a lot of times.
So what I can do is I can talk to customer service to see if they have any literature ahead of time that they can say, like almost like a questionnaire. If not, I can put on like a Word doc. I just have to get it approved with questions that somebody can ask. Because I used to, when I was an enroller back then, I used to work with the refugee camps and the immigration, like all the farmers, and I can't speak Spanish, and majority of them speak Spanish. So what I did was I created a question sheet in Spanish for them to write out their answers, so I can then plug everything into the system for them without having to try to figure out what they need. So I can see what our customer service team has and maybe send it over to you. So that way it kind of just gives them an idea what the questions are going to ask for and what the services they need.
That would be great. So if you can send to Hannah, Hannah can give it to me. And
Okay.
then I can just let the guy know before you talk to customer service through an interpreter line. Let's
Okay.
review this question first so you know what to answer.
Do you know, does he already have active health insurance?
Yes, he does.
Okay, because sometimes, and this is just food for thought too, sometimes it's quicker to go through like an enroller, like a facilitator enroller, like Maria or the other people on the team. It's quicker than it would be a DSS sometimes. So that's why we always tell everybody that if you need health insurance, meet with a facilitator enroller because it's quicker, it's a quicker process, and your start date's quicker. Sometimes with DSS, you're on a waiting list or, things happen where they're backed up because like right now, currently COVID's backing them up. So, it just depends on what their needs are and how fast they want their insurance. But usually meeting with an enroller will get you insurance quicker.
Well, that's why I got the number. So from now on, if I know someone have Medicaid and does not have a managing care yet, I will refer them to this number you just gave it to us.
Perfect. And the other thing too is if they have Medicaid already ahead of time. So Maria mentioned straight Medicaid. If they have straight Medicaid, what we can do is on their benefit card, they have what's called the SIN number.
Yeah.
That's their insurance number. If you have their SIN number, you can always send it to us or send it to me, and I can look them up in a system called ePaces. And what it will do is it'll tell me what insurance they have. It'll tell me their start date. It'll tell me who they're active with, if they have only straight Medicaid. It will also outline the covered benefits. So, and the difference between straight Medicaid and managed care Medicaid, the insurance is identical. The only difference is that most doctors won't take straight Medicaid.
Mhm.
They
That's
want
true.
a plan to back them up. So
That's
that's where the Excellus, Fidelis, United stuff comes in. But if anyone has straight Medicaid, I would just tell them to definitely switch to a managed care plan, whether it be ours or someone else's. because you'll get a lot more covered services and a lot more benefits having a managed care plan versus straight Medicaid. The only place you can go with straight Medicaid, honestly, is a hospital, and that's it. So they'll definitely want to encourage you to get into a managed care plan.
Yeah,
I have a student, can you guys hear me?
Yes.
Okay, a student was wondering if you could clarify really quick the basic difference between Medicaid and Medicare.
So Medicaid is for anyone under 0 to 65. That's Medicaid. Medicare is going to be 65 and over.
Okay.
So if you're somebody who's Medicare, we do have a Medicare team. And they can, if you have anyone that's 65 and up, we can have somebody come on and talk about Medicare too. So for our team, we work with Safety Net, which is going to be the under 65 population, 65 and under. So for Medicare, they have there's a lot of different services because they're based off letters. So, Part B means one thing, Part C means you have a plan, Part D is prescription. So there's a little bit more that goes into Medicare, but Medicaid is 65 and under, Medicare is 65 and over.
Okay, perfect. Thank you.
Francis Classroom has a question as well. Go ahead, France. I've seen you unmute.
So I don't want to belabor the point with the assistance, and I'm not entirely clear. So you're saying that if a student or one of our people that we serve calls, that even if they give verbal permission, that they can't be helped because of HIPAA laws? Is that correct?
That's customer service. So for our standpoint, it's a little from us and helping, we can enroll them. What it sounded like, how I took the question that was asked was like, you can't call on behalf of someone else. That person
But
has.
if you're with them, you can.
So yes. So so I'll give you a good example. So let's say somebody needed health insurance and I needed to call New York City Health. Because I'm an assister, I can three-way that person in. And as long as they give permission on the phone, that usually they will they'll usually allow us to help them with their application. So, but with Excellus and with any health plan, there are HIPAA laws where certain things, the certain information is protected. So it just depends on what the need is.
Because I just want to say, like, not trying to throw a barrier in there, but we definitely work with people who are not literate in their language.
Right.
So, so that's just a barrier there that is to take into consideration. And then I had a student who said they have not been helped well with the translation piece. They were like, that wasn't in their case. We don't need to get into that right now, but just something to kind of put that out there. Okay. Thank you.
So, right. So what I'm going to do is I'm going to just work with our customer care team to see what they have available, just so that way students have an idea of what may be asked on their call. But usually they always verify you first. So they're always going to ask you for your name, your date of birth, if you have a social security number, those kind of questions they'll usually ask you for just to validate you in the system, or they'll just ask you for your member ID number, which it will be on your card. So once you give them that information, they usually will kind of answer whatever questions they have. So whether it be, can I go see Dr. ABC, or can I go to this dentist, or is this procedure covered? So it just depends on what their needs are and what they're looking and what their questions are. I hope that answered the question.
So you're going to talk to the customer service team about, handing out questions that could be asked or are
Yes.
typical of asking. And then, yeah, you can send that to me. And I don't know if there's a way to talk to whoever translates, or if that's possible, just to, just be upfront and clear with people who are trying to act on behalf of people or work with somebody and assist somebody in getting the help they need with insurance. I
Right.
don't know if that's in your alley, but I just didn't want to forget what France was saying with just the barriers and stuff that are with the translators and assisting sometimes.
Right. And sometimes too, so I've worked with other agencies where there is a language barrier. So if somebody's able to translate, if they, let's say they're in the beginning process of needing health insurance, if somebody's able to translate while I'm there, I can still help them with their application because there's that consent given. It's just when you call customer service, they also have their own guidelines too and their own procedures they have to follow. So, and the translation, I'll be honest, translation is a tough thing across the board. It's just because it's just so hard to understand what somebody needs, especially when they don't speak the language that is spoken here. So it's such a process. I mean, I hear with so many agencies about translation. So I can understand. So the best way to do it, I would say, is if it's in the early stages of needing health insurance, is to, if you want to, reach out to me if they need a enrollment process, and I can link them up to a FE who'll do the same process I would. Or if it's a question about a covered service, just ask me first. And what I'll do is I can research it for them and then come back and let you know. That way you can kind of cut out that middleman of the translation and of anything else.
Okay.
That's great. Then we can call you, Mike.
I'll be here. So, and
Thank you.
once this is situated, I mean, I know we're still in like the COVID area. You know, you'll probably see a presence from Excellus on campus or in the school. So where we may have a designated time where we may set up a table and say, hey, we're here from 10 to 12 on Tuesdays. Pop in and see us if you have questions, concerns, you know, so on and so forth. So
Yeah.
that way they can kind of recognize who we are. So it's not just like, who's this random guy I'm giving my information to thing. So
Great. That would be really great. Right.
any other questions?
I think we're all set.